Welcome, and thank you for joining us today. My name is Preeti Singh, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's experts will discuss the growing health consequences of extreme weather and climate change. I'd like to briefly introduce our speakers. Sonia Angel is a Bloomberg Distinguished Professor of the Practice of American Health in the Departments of Epidemiology and Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Megan Latshaw is an associate teaching professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health and co-directs the Institute for Planetary Health's education program. Professor Angel and Professor Latshaw are core faculty members in the Bloomberg American Health Initiative, which is a collaborative program that addresses pressing health issues in the U.S., including food systems, environmental challenges, addiction and overdose, violence, and adolescent health. We will have time for questions following our speakers' remarks. We will take some that have been submitted in advance of the briefing and some from the Zoom chat. If you have a question, please enter it in the Zoom chat addressed to panelists and hosts. Please enter your name, media outlet, and question. We hope to cover as many as possible. Please note that participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. Participants will be muted during this briefing, and it will be recorded. Let's go ahead and start. Professor Angel, while preparedness for extreme events is essential, climate-related changes outside of and at the tail end of those events are also impacting our community's health. Can you tell us a bit more about these threats and who is at risk?
So, health impacts related to extreme events that often become evident after an emergency response has ended include mental health conditions like PTSD and depression, and increases in overdose and suicide. We also see exacerbations of underlying conditions like heart and lung diseases. The disruption of healthcare access during an emergency can also worsen outcomes by delaying ongoing cancer treatment or also by interrupting the management of chronic conditions like hypertension and diabetes. Damaged infrastructure can trigger allergies and asthma through the growth of mold in buildings after floods and hurricanes. But it's not only the extreme events that we need to worry about. Increased heat and poor air quality are common climate-related changes that can impact our health even before they reach levels that trigger extreme weather warnings. In fact, the majority of heat-associated deaths occur at temperatures below the threshold for a declared extreme event, often by causing exacerbation of an underlying condition like heart or lung disease. And when heat is combined with poor air quality, it's even more dangerous, increasing the risk for heart attack and early death. So who's at risk? So anyone can be negatively affected by these environmental changes, but certainly some of us are at greater risk. This includes people who are older, infants and young children, pregnant people, those with underlying health conditions like heart disease, lung disease, or diabetes, and people on certain medications that can increase their heat sensitivity. People who work or do recreation outside are also at increased risk, like agricultural workers and construction workers and athletes.
Right. Thank you, Professor Angel. Now, a question for Professor Latshaw. You have studied how well prepared states are to deal with the health impacts of climate change. What have you found?
Found that no state is well prepared to address the health impacts of climate change. Across the board, states could do better when it came to improving social connections and resources, pre-hospital care, and mental and behavioral health care. So one example of what I mean by improving social connection was a program in New York City called Be a Buddy program. And under that, the health department trained community organizations to do outreach among the people who live in their community, and also to help disseminate public health messaging during weather-related emergencies. And those organizations were able to reach hundreds of at-risk residents over the next year after that program first started. The other thing that I talked about, so I said across the board, states could do better when it came to social connections and resources. Pre-hospital care was the next one. And people might wonder, what is pre-hospital care? That's basically the care provided by emergency medical services and 911, and those could be improved, and as well as mental and behavioral health care. The other thing that we found was that a lot of states had identified climate hazards. So they knew what the risks were in their jurisdiction, but a lot of them hadn't actually connected those climate hazards to health risks. And so that was a gap that we identified. And then one of the other gaps was that not a lot of states had actually implemented interventions. So once you identify the climate risk and then you identify the related health risk, what you should do is you should do something about it. You should create an intervention. One of the most common types of interventions that we saw was heat warning systems and cooling centers. So those are just some examples of what states could be doing to prepare more for the emergency side. Dr. Angel talked about the non-emergency health impacts of climate change. We were looking more at the emergency aspects of it. And the last thing I'll say is we found that the most vulnerable states, the states that had the highest risks associated with climate change, were the ones that were least prepared to deal with the health impacts of climate change. And that was really shocking. You would hope that the most vulnerable states were the ones that were the most prepared, and that is in fact not what we found.
Thank you, Professor Latshaw. Now we will take questions. A reminder, if you have a question, please enter it in the Zoom chat with your name, media outlet, question, and to whom you'd like to address your question. For Professor Angel, can you answer how we can protect ourselves from these sometimes invisible, non-extreme climate threats?
Yeah, so when we're talking about threats like heat or poor air quality, the most important thing to do is, first of all, make them visible. So we can do that by redesigning our approach to surveillance. During an emergency response, the kinds of responses that Dr. Lakshaw was just responding to, our systems really focus on the immediate impact of an event, counting direct fatalities, injuries, and property damage. These are really important indicators for the emergency response. But government health departments can do more, and many are. They should be expanding their existing non-emergency health tracking systems to include measuring and reporting on the impact of common climate changes like heat and air quality on health, so that we understand what's happening not only during an event, but after and between events as well. So with these clear metrics, health departments can track trends, identify vulnerable populations, and design and evaluate interventions that can help to protect our health. This knowledge allows every other aspect of resilience, from planning, adaptation, and response, to be more effective. We should also be reframing our climate response to really focus on resilience, which means shifting from a reactive mindset to focusing that focuses more on individual disasters to being proactive and having an ongoing approach. This includes engaging our healthcare delivery systems, public health systems, and communities to co-create changes that will help reduce the likelihood of exposure to negative climate changes and also prevent the likelihood of negative health impacts if people in our neighborhoods are exposed. Basically, we need healthier neighborhoods all the time to be resilient at those times when our climate creates threats. Neighborhoods can do this also by greening their communities, by planting trees that can reduce temperatures and improve air quality. Care delivery systems can use electronic health systems to identify patients that are higher risk. And when we know which patients are at risk, then we can deliver interventions like air conditioners in advance of warm weather, and also address energy insecurity so that they can run those air conditioners and stay safe. And then, of course, all of us should pay attention to weather forecasts. The air quality index, temperature, and humidity reports can help us understand when it might be better for us to stay inside to protect our health. And it can also remind us to check on neighbors, especially those who don't have air conditioning, who may live alone, or who may not be mobile, to make sure they're also safe when the weather is not good.
Thank you. Here is a question for Professor Latshaw from Jess Mador with WABE FM radio in Georgia. Can you describe the impacts of extreme weather and solutions in the southern US and Georgia?
Absolutely. So when you think about the Southeast, you think about especially along the coast sea level rise and coastal flooding. There's a lot of new developments growing along the coast in the southeastern part of the United States. And that means that people along those shorelines are at risk of injuries or displacement, and in the short term, and in the long term, mold related issues or stress. One of the things that we see the most is communities that are hit by repeated floods. In between floods, they feel a lot of stress, and if there is rain, then they feel a lot of stress. So that's sort of that in between that Dr. Angel keeps talking about. So sea level rise and coastal flooding is one. Extreme rain events, especially in the fall in the Southeast, and that can lead to flooding. Extreme heat, especially impacts urban populations in the Southeast. And extreme heat can lead to labor losses because if it's too hot to work, then you're going to be losing some economic inputs. And extreme heat also leads to warmer water, which can lead to harmful algal blooms. So people might not be able to swim or to use the beaches without risking impacts to their health. There's also longer dry spells in the Southeast, especially in the spring and the summer, which, along with extreme rain events, can impact water supplies. And, all of this impacts agriculture. And so there are solutions. There are things that we can do about this. So it's not just all about identifying problems, right? There's interventions that we know work. For example, when you talk about agriculture, farmers can respond to water shortages by irrigating according to soil moisture and growth stage. They can use cover crops that will help maintain soil moisture and nutrients. And maybe one of the most important things is governments can have comprehensive climate adaptation plans that can include things to respond to sea level rise, like seawalls or levees. Maybe during the planning process, communities might talk about raising up structures to protect them from the flood risk. And also we can think about things like infrastructure, sewers that can handle heavy rainfalls better so that the floods don't happen. Those are just some examples.
Thank you. Here's a question for both of you from Mandy Gaither Nottingham from CNN News Source. You talked about what states can do to deal with the health impacts of climate change, but what can people and families do to protect themselves? And I wonder, Professor Latshaw, if you could take that first.
Sure. So I think one of the most important things you can do is to be aware of what risks are in where you live. So you should know if you're at risk of wildfires, and you should have a plan for what you're going to do during those wildfires. If it maybe you buy an air filter, or one of those air cleaners. Maybe you have lots of filters for your air conditioner so that you're prepared to change them out a lot more frequently than you would otherwise. If you're at risk of floods, maybe you think about what you're going to do before the storm hits, and you monitor the weather more frequently. You should always have sort of a ready pack, so a flashlight. You should have enough drinking water, in case there's something wrong with the drinking water system. And you should have, talked with your family about what you're going to do and how. Now, I'm talking more again about the extreme weather, and I think maybe Dr. Angel can talk a little bit about the in-between, not to put you on the spot, Dr. Angel.
Yeah, no, really excellent. I think I would just add to that. Maybe think about the resources you have in your community that can help give you guidance specifically to your needs. So a primary example would be your healthcare provider, who can help help you think through what your risks are. You can talk about your underlying conditions, and they can help you develop a very specific plan. What kinds of medications do you need to have in advance? So for example, if you have asthma and you know that you live in an area where there have been a lot of wildfires, and you know the smoke is also often compromised, or if you live in an urban area and the air quality is not always great, your physician can help show you how to use the indices, the air quality indices, and help you understand how to respond. They can make sure that your inhalers are refilled, so you always have them on hand when the weather changes. Those are the kinds of things that talking to a provider can help you figure out. They can also help you think about whether or not an air conditioner, if you don't have one, makes sense for you, because perhaps you have underlying heart disease or something else that might get exacerbated when the temperatures go up. And then in addition to that, don't forget, even if you have an air conditioner, you need to be able to run it, which means we need to make sure that our communities have access to the energy that they need to run it. Energy insecurity is a big issue in the United States. Almost 1/4 of Americans have energy insecurity. So just having an air conditioner doesn't mean that you necessarily have the resources to run it. And so talking with your physician and others in your community, if you lack resources to be able to run your air conditioner at the temperature to keep you safe, then you can work with the city. There are many programs that can help you get access to help for that.
Thank you. Here's a question for both of you from Kayla Hunter with the Ledger Inquirer in Georgia. One of the things that is challenging as a reporter is attributing heat or climate to the illness that someone is experiencing or even death. For example, there is no climate change heat on a death certificate. What sort of measures are hospitals or doctors doing to incorporate attribution to patients who experience illness? Dr. Angel, perhaps you can look at this first.
Yeah, this is a really important point, and this comes back to this issue around measurement and how key it is that we are able to measure and understand the impact of climate change on our communities in order to develop appropriate responses. So at this time, the specific diagnosis that we have is a heat-related illness such as heat stroke, or that will get actually coded at the hospital. But the exacerbation of underlying conditions, absolutely correct. These are things that don't end up in the medical record often, and so we don't know whether or not that specific individual's event was related to the heat or not. Ways in which we've seen analyses that have helped at a population understand this better are through assessments of excess deaths. So recently in LA, after the fires, a study that was done to look at excess deaths demonstrated that while there were only about 30 deaths reported directly due to the fires, there was actually during that month an excess of 400 deaths that wouldn't have occurred otherwise, and therefore have been associated now with the fires in Los Angeles. Similarly, in New York City, they do an excess death analysis as well, and many communities across the United States are looking at that. It's not something that is done consistently in every place, and this is one of the opportunities that we have when we're really thinking about planning in communities, is for health departments and others to really think about how do we invest in understanding this risk better so that we can develop interventions that are appropriate to the threat.
Thank you. Dr. Latshaw, did you have anything to add?
No, Dr. Angel did a great job.
Thank you. Here's a question for Professor Angel from Raiz Ahmed with the Dhaka Tribune in Bangladesh. How could Dhaka minimize its heat vulnerability in the future?
So like many other cities in the world, Dhaka is subject to something we call the urban heat island effect. Now, that's an observed phenomena that's associated with cities, because cities produce their own heat. So we'll see that cities can have 10 degrees or higher temperatures during the same day than the rural areas outside of them. That happens for two reasons. First of all, cities are living and growing beings of their own, right? We produce heat in our homes. We use energy, transportation, cars, energy consumption, all of these things produce heat. On top of that, our urban areas right now oftentimes have asphalt, fewer trees, and all of those things increase the trapping of heat and therefore increase the temperature. So a place like Dhaka with many people has that experience of this urban heat island effect. But that's engineered in, and we can engineer that out. So Dhaka, like many other cities, are looking at ways in which they can decrease asphalt, increase trees, look at more efficient ways of energy production, energy use, all of these things that can help reduce the production of heat in the city and decrease the heat trapping of the city are ways in which we can work to make the cities cooler. On top of that, understanding where vulnerable populations are is a very important piece of the work. And I know Dhaka has that underway right now, really trying to map out and understand where are communities that may be more vulnerable to the heat, even when it does exist, and to try to develop interventions in those spaces. So it's this combination of understanding what's leading to the increased heat, taking action to try to decrease the temperatures overall, and then developing interventions to help protect those that are at greatest vulnerability. And those combined can help create the resilience that cities need today to be able to manage manage the threats of our changing climate.
Thank you. Here's another question for Professor Angel from Mandy Gaither Nottingham at CNN News Source. What specific health problems can extreme weather or climate change either cause or lead to?
So extreme weather, whether it's an extreme event or just this increasing heat and poor air quality, can affect virtually every organ in the body. So it can increase our risk for heart attacks and strokes. It can increase our risk for the development of lung disease and exacerbation of underlying lung disease. It can lead to metabolic disruptions. So people with diabetes can run into problems and end up in the hospital as a result of exposure to extreme heat, for example. Pregnant women, it can increase the rates of birth defects and poor birth outcomes. These are all things that are currently being deeply studied to try to understand how we can help protect ourselves from the impacts of climate. The big sort of take home to this is that all of us are at risk to some degree. Some of us are at greater risk, and we need to understand our individual risk so that we can take action to protect it. And we can do that by working with our physicians, working in our communities, and working with one another to see how we can create healthier environments for all of us.
I would love to add to that, sort of maybe reversing roles with Dr. Angel. Some of the more less extreme weather health impacts that happen in between the extreme weather impacts are we're seeing increasing allergen levels because a lot of weeds grow better in higher carbon dioxide settings and higher heat than the crops that we actually want to grow. And we're seeing longer allergy seasons as well. And so that's something that sort of happens in between these extreme weather events.
Thank you. Here's a question for Professor Latshaw from Apollonia Adeyemi with the New Telegraph in Nigeria. Is there a link between extreme weather and climate change? And the second part of that question, which I think you may have addressed, in what specific ways do extreme weather impact public health, and what are the mitigating factors?
There is a link between extreme weather and climate change. So climate change is leading to warmer temperatures on the planet, and warmer air holds more water or more moisture than cooler air does. In fact, for every 1 degree of warming, the atmosphere can hold 7% more moisture. And that additional moisture in the air leads to more extreme weather events, more extreme precipitation, like severe rain and snowstorm, and that increases the risk of flooding. And then flooding can impact our health in many ways. So, for example, during floods, you might be injured. You might be swept away in the flood. Maybe you're walking through floodwaters and you step on something and sustain an injury that way. Flooding can also lead to death. It can lead to mold growth after the floods recede. So that's just one example of the link between climate change and extreme weather, but there's others. Warmer oceans lead to stronger storms. So hurricanes and tornadoes, or cyclones as they're called in other parts of the world, they draw their energy from warm ocean water. And so the warmer the oceans, the stronger these hurricanes and tornadoes or cyclones are. And then with increasing temperatures that we see with climate change, there's also increasing evaporation, and that can lead to drought, right? So if water is evaporating, you don't have as much water available to you, and it dries out the land, and that impacts agriculture. And that's another sort of long-term, in between extreme event impact of climate change on health. If agriculture is suffering, if we don't have enough water to irrigate our crops, then we don't have enough food to feed people. That has a big impact on health. And one other item that I'll mention is we are also seeing that crops have fewer nutrients as the climate changes. So with higher carbon dioxide levels, they're not able to incorporate as many nutrients into the plants. And so the food that we are generating as the climate changes has lower nutritional levels, which I think is really interesting. So those are just some of the links. Sorry.
Thank you. This is our last question for Professor Angel. Much of the discussion around climate change and health focuses on medical preparedness. What role do housing, transportation, and economic inequality play in shaping who suffers the most during climate-related health crises?
Right, those elements of our environment are the quality of our jobs, the quality of our housing, transportation. We know all of those things are necessary to be healthy. We know that people who have access to good, high quality jobs have higher income. They're able to buy higher quality food. When they live near places where there are parks, they're able to exercise. When they have transportation, they're able to get to and from work easily, to access medical care, etc. These are all, while sometimes not considered direct health elements in our community, they produce health. They produce health by being around us. They make our communities healthier to be in. On the flip side of that, we know very clearly, and the evidence bears this out, that communities that have less of those resources have less opportunities to be healthy. There have been studies that have been done looking at the impacts of redlining, which are policies, discriminatory policies that have been in place from the 30s to the 60s that reduced investments in specific communities. Those communities today have fewer jobs, they have their infrastructure, their neighborhoods, there's more asphalt, there's fewer trees, fewer parks, and as a result, those neighborhoods are hotter. And we also know those communities have a higher burdens of illnesses like heart disease and lung disease. So when you think about that, when you think about communities that don't have the ingredients they need to be healthy, and you add on top of that a change in climate that is exposing them even more to additional heat and less quality air, additional poor quality air, we know that those communities that are starting with fewer resources are ending up bearing the greatest burden of impact, health impact from this change in climates. And that in turn makes all of our cities less healthy. Because when one part of the city isn't doing well, all of our cities aren't doing well. When some of our communities aren't doing well, all of our communities eventually feel the impact. And so these are important resources to think about. When we build resilience in communities, we need to think not just about the health departments and the healthcare systems, but we need to think about all of those elements in the community that keep people healthy. To create resilient communities, we need to invest in those areas as well.
Thank you to Professors Angel and Latshaw for your insightful answers. We will email the links to the resources mentioned today and shared in the chat. With that, I'd like to say thank you again to everyone for joining us today. A link to this recording will be provided later today.